Do you guys remember how last week I had this super gorgeous man on my channel? Well, did you also know that this guy used to look like this guy? Meet Matt. MattDominance is one of YouTube's leaders in understanding hair loss from a scientific perspective, and I was lucky enough to be able to get him to come on my channel and answer all of our burning hair loss and hair transplant questions. This video is part 2. Stick around. After I spoke about my hair loss online, I was getting a lot of comments from women all over the world, especially about the one with that one video that went quite viral. It has about 300,000 views. And I was getting a lot of questions, actually a lot of statements regarding you need to use garlic, you need to use castor oil. Castor oil saved my hairline and all of this stuff. Do you think, I'm a huge skeptic when it comes to natural remedies. Have you come across anything natural that you think really does prevent hair loss or keeps the hair on your head or even regrows hair that has been lost before?
Okay, good question. Well, let's start first, or let's address the issue why there are actually so many people nowadays on YouTube, especially promoting these natural remedies. And well, if you see a video on YouTube which has like 100,000 of views where a girl is applying garlic and coconut oil on her scalp in order to regrow her hair with really thousands of likes and comments, it doesn't always mean it works. Okay, first, why such videos tend to get many clicks and views? People like to watch simple hacks for everything in life, and it's the same with hair loss. People believe there is the simple hack for everything, but when it comes to hair loss, things are more complex than the average person may think. Natural remedies besides saw palmetto are pretty much useless for the following types of hair loss: androgenic alopecia, which is known as male or female pattern hair loss. We have cicatricial alopecia, the scarring hair loss. We have traction alopecia, which you had, and temporary hair loss like telogen effluvium, which may or may not even self-correct, oftentimes without any medical intervention. I will come to that self-correcting hair loss at the end of this question. But before that, the only area of hair loss where natural remedies like garlic or onion could work would be alopecia areata. Now, I don't know if you have heard about this hair loss. This is the autoimmune hair loss, which looks as these patchy, rounded spots, not only on your scalp, but also on your body hair and facial hair if you're a guy. We still don't know why alopecia areata is happening, but when it occurs, the immune system of the body is attacking the hair follicle and hair follicle stem cells as well, and it causes inflammation. Now, the hair breaks off pretty fast. Unfortunately, there is no effective treatment for it, but garlic and onion have shown some efficacy in this type of hair loss, but unfortunately this is like 0.2% of people that experience this type of hair loss, so it's pretty pointless to kind of even suggest garlic and onion for the types of hair loss that most of the men and women experience. So there is also peppermint oil and pumpkin seed oil and similar oils which have been studied a little with pretty low efficacy, and I wouldn't even compare them to treatments like finasteride or minoxidil, which are much more superior. The only natural remedy, as I said, that comes closer to the clinically observed treatments like minoxidil and finasteride is saw palmetto or Serenoa repens. It's a natural herb which comes in a supplement form. Usually you can buy it also on Amazon. This herb has been shown to reduce DHT systemically, dihydrotestosterone, in some studies which were done on patients with benign prostatic hyperplasia, a syndrome of enlarged prostate. So the mechanism of action of saw palmetto is similar to finasteride, or better said, dutasteride, but it's a natural version, and thus it's less potent. But it can also come with side effects like lower libido symptoms or erectile dysfunction in men, and I have personally talked to guys who are using that and experienced also some side effects. So far, all the treatments which successfully target the hormonal side of hair loss have been shown to come with side effects always. You know, the risk is always there. So if there is some treatment that is known for no side effects, I'm always very skeptical whether this treatment is potent, whether it really does something to the hormonal side of hair loss, and usually not. What all these treatments or natural remedies have in common is that they are all just experimental treatments with low to no clinical evidence. So you may try them out, but you're also risking losing the time during which these natural remedies won't work for you anyways, and you will lose more hair which you could have saved had you started with proven treatments right away. So my piece of advice would be to be always looking at clinical evidence instead of anecdotal evidence, what one person says that worked for him, or things like this. Okay, and also if you have to bear in mind that that people may have like different types of hair loss, and what works for temporary telogen effluvium won't work for androgenic alopecia, which is a more permanent type of hair loss caused by male hormones. And many times I see these people on YouTube during these, like making these videos about hair loss, they're freaking out about sudden hair loss, which is usually caused by either like sudden stress, could be also like undergoing surgery, crash dieting. These things can all cause like temporary hair loss, which is oftentimes self-correcting, and these people then try these natural remedies and the hair comes in fact like back 3-4 months later, but not necessarily as a result of using the natural remedy, but as a result of hair loss just self-correcting itself without any intervention. It happens very often, and I also know people on YouTube who are kind of abusing that and misusing that and selling like natural products and natural topical serums, and I have I think I got so many messages from different guys asking me about really useless products. I really wonder how they even still believe that they work after watching like my channel for a while, and it's simply because a guy, he experiences a sudden hair loss which is self-correcting, but he's also gonna promote a product while his hair loss is self-correcting and then claim that that product was the reason why the hair came back.
Matt, since you started talking a lot about minoxidil and finasteride, a lot of people don't know what that is. Could you go into minoxidil and finasteride from a woman's perspective, because the majority of my audience is women? So can women use Rogaine? Can women use finasteride? What are the benefits, and how do you use it? How does it work?
Well, first of all, Rogaine is just a brand that contains minoxidil. Either it's a 2% or 5% one. The 5% version is FDA approved for male hair loss, and 2% one for female pattern hair loss. But there are different brands like Rogaine, Regaine, and like everybody can create a product with minoxidil in it because there is no patent on it. The mechanism of action by minoxidil is not fully understood because it has never been like primarily studied for hair loss, but it has been accidentally discovered when it came in the oral form, and it was antihypertensive drug for lowering blood pressure. And as a side effect of all these patients using oral minoxidil for lowering their blood pressure, they observed hair growth on the whole body and scalp, and that was the reason why they started developing a topical formulation of minoxidil and marketing it as a hair loss miracle back in the 1990s, when, funny enough, a third-month supply used to cost like 10 to 15 times more compared to what it costs today, okay, because it was new and everybody believed it's going to be a miracle. Now, as I said, we still don't know how minoxidil works on the inside, but on the outside it has been shown to prolong the anagen, the growing phase of the hair follicle life cycle, and thus delaying the telogen resting phase of the hair follicle when the hair during which the hair is falling out. Who does minoxidil work for, and who does minoxidil not work for? Well, minoxidil doesn't work for people with low activity of sulfotransferase enzyme on their scalp, and this enzyme converts the inactive ingredient which Rogaine kind of contains, minoxidil 2% or minoxidil 5%, and it converts that into minoxidil sulfate, which is actually responsible for the benefits like prolonging the anagen phase of the hair follicle and things like this. Unfortunately, there is no other way to test how well you will respond to minoxidil, even if you are a man or a woman, but trying it out and see, that's the only way.
So let's talk about finasteride then, since you talked about minoxidil for women. Can women take finasteride, and why or why not?
Important to know that finasteride is not FDA approved treatment for treating female pattern hair loss, although it's helping, and that's why it's being used as an off-label treatment. Now, if you are interested in taking it as a woman, it should be used together with oral contraceptive as well, especially in women with childbearing potential, okay? So that's important, and that just because if you have like a baby accidentally, finasteride can actually cause like birth defects to the male or female fetus, and that's not actually only to the male fetus. There are some studies on animals on that, so that's why it's not advisable. Now, when it is not advisable also to take finasteride as a woman, it's not advisable again for pregnant women, as I said, because you can cause the birth defects. It's not advisable for women with liver issues like hepatic impairment, because finasteride is being metabolized predominantly in the liver. And also it's not advisable to women with a family history of breast cancer, for example, because finasteride interferes with estrogen testosterone balance, and it can also promote breast cancer in women with family history of this type of cancer. Yeah.
Okay, yeah, so my suggestion for women that are watching and that are desperate, your hair is not worth getting breast cancer. Don't take it.
Yeah.
If it's not FDA approved, if there's so many complications, I just stay away. Like, why? It's just not that important, right?
Yep.
And if you guys have any questions, if you got through this whole thing and have all this new information, if you have questions for Matt or for myself, then leave it in the comment section below. We can monitor those comments and try to get back to you as soon as possible.
Yeah, just comment below. I will check out the comment section of this video once it's going to be published, and I'm gonna also interact and answer some of the questions that maybe I didn't answer with your questions, and yeah, help you guys that way.
All right, I'll see you next week. Bye, guys.